Hi, I'm Dr. Shuparna Bhattacharya, consultant at Nova IVF Fertility East. Today we'll discuss body mass index and its relation to fertility. By body mass index, I mean BMI. Most women with their weight usually do not have any problems conceiving, but what we can take into account is the underweight and the overweight people, which is decided by the body mass index. Women with more or less body weight tend to have irregular periods, and they face consequences because of that, because there is no ovulation. So they have to keep an account of this weight and then come into treatment. Women with more body weight, we usually say between 19 to 24 is normal, less than 19 is underweight, and more than 24 we say is overweight. More than 30 it comes out to be obese. Men also come into the factor once their weight is concerned, because they also tend to have responses abnormal when it comes to their body weight is concerned. Their sperm counts are abnormal, their libido is abnormal, their ejaculatory functions become abnormal. So men also have to take into account their body weight, and the body weight becomes very important. In cases of women, once they conceive, the overweight women tend to have increased medical problems as well, maybe diabetes, maybe pressure during their conceiving, increased miscarriages, lower success rate. As far as infertility is concerned, when we put them in for treatment, we usually advise them to reduce their weight because it is a feel-good factor. According to the research, it is said once they reduce their weight by 5% even, then they tend to have a better prognosis. In case of infertility treatments, as far as we are concerned regarding the body weight, they would need more drugs and more stimulation to make more oocytes. So as far as weight is concerned, both women and men have to keep their weight in check, because they have consequences regarding weight for both cases. In case of men also, if they have an increased body weight, then their sperm counts go down, they have a reduced libido, they have a sexual dysfunction, and as a result of that there is infertility. In cases of women, be it natural conception or ART conception, they face consequences of medical problems, hormonal imbalance, irregular periods, and insulin resistance. During pregnancy also they have increased chances of miscarriage, increases cesarean section, and more chances of developing diabetes and hypertension during the pregnancy. So when we say we advise before they come into treatment, we advise a lifestyle modification for them, which is a strict diet, exercise, sleep, rest, and reduce stress to improve their weight. But at times we have seen it becomes very difficult. What you have to take into account is whether you have to manage the weight or an elderly lady who's losing on her ovarian reserve. So that becomes a dilemma for us. In that scenario, we work on both, keeping in mind the body weight and also the ovarian reserve. If the ovarian reserve is fast declining, then we will advise treatment straight away instead of waiting for her to reduce the body weight.